Great, super. So welcome to everyone to another in our KEDA series of webinars. This is our last webinar for a while, and they'll be back in the fall. We hope you plan to join us in Salina for the KEDA Fall Conference, September 21st and 22nd. The lineup is coming together and will provide valuable information for all attendees. Speaker highlights include economist Chris Keel. Dr. Keel is fabulous, seen him several times. We had him as our LCDC keynote speaker in January, and that's going to be a real treat. Global Logistics Solutions will show us how to offer virtual site visits, which is a good skill to have these days. Colleen Walton will give us tips to address workforce shortages. We'll hear an update on the Kansas statewide housing study with a panel of specialists. We will also have breakout sessions with tourism, labor, and workforce discussions. On the evening of the 21st, we'll host a networking dinner in newly renovated downtown Salina. You can get your hotel reservation now at Salina's Hilton Garden Inn using code 9KEDA and be watching for more information. Again, that code is the number 9 followed by KEDA. Everyone's mic has been muted, but the chat box is open. I encourage you to enter your name and title in that box as a way of letting everyone know who is here. We'll be taking questions throughout the presentation, so please enter your question there. We will read your question, or we have a small group this afternoon. We may just unmute you and you can ask your questions then. So let me now introduce my colleague from just a little bit south of Leavenworth County Air, Miami County, Janet McCrae, to introduce our speaker.
Thanks, Steve. For those of you who are not aware, May is Mental Health Awareness Month, so it seems pretty fitting that we have Kyle Kessler with us today. He's the Executive Director for the Association of Community Mental Health Centers in Kansas. He has nearly 20 years of experience in public policy analysis and development, with more than 15 years of experience in health and human service public policy exclusively. He began his career within the state of Kansas government, where he worked 10 years as a Deputy Secretary for Public and Governmental Services within the Department of Social and Rehabilitative Services. There he was responsible for management of the agency's governmental affairs, communications, and customer service functions. He also has experience working in the mental health field's private sector. Kyle does serve on the board of directors for Health Source Integrated Solutions and Compliance One. He also serves as the Vice President for the National Association of County Behavioral Health and Developmental Disability Directors. He previously served as President of the Kansas Children's Alliance and as Treasurer of the Kansas Head Start Association. Has a bachelor's degree in political science and history from Emporia State University and a master's in public admin from Kansas State University. So Kyle, thanks for joining us today and sharing some things that we need to be hearing with everything that's going on in the world.
Thank you so much, Janet. I appreciate it. Appreciate you sharing your screen, and I will see if I can. There we go. And again, as Janet mentioned, I am Kyle Kessler, Executive Director of the Association of Community Mental Health Centers. We appreciate the opportunity to be here with you this afternoon. Certainly, hello to Dr. Leslie Bjork, the Executive Director at Elizabeth Layton Mental Health Center, she's one of our members and actually sits on our executive committee at the association. And Elizabeth Layton Center covers Miami and Franklin counties. Also on the call with me is Michelle Ponce, who's our Associate Director at the association and had worked with me in state government. I semi-joke that she does what I do, just faster and smarter. But at some point, I will probably refer to her because she's also been very active in some of our initiatives this year in public policy. And just to give a quick overview of the community mental health center system and how it probably affects economies around the state, or should. We have 26 licensed community mental health centers, or CMHCs, that serve all 105 counties. So whether you live in, yes.
I don't think your slides are sharing. If you're trying to do that right now.
I am. Thank you for stopping me. Let me see. How about now?
There you go.
Thank you. Yeah, this is, you really can't tell, but this is the first time I've ever used shared screen and shared a PowerPoint. So we only did a trial run on this about 40 minutes ago, and I already forgot the first part. So we'll go ahead and get into now. You should be able to see slides. So whether you live in Liberal or Leawood or Norton or Neodesha, all over the state, there should be access to a community mental health center. And they range, as you'll see, the northwest part of the state, that mental health center has coverage of 20 counties. And he is one of Leslie's colleagues, Walt Hill, and he takes some amount of pride in telling people how many times the state of New Jersey geographically would fit in his catchment area. And then you see other counties that just have one, or some mental health centers just have a single county, and others have anywhere from 2 to 10 or 13 even. So that's what our map looks like. And the mental health centers around the state have combined staff of nearly 5,000 people that provide mental health services in every county of the state, over 120 locations, and all contract with the Kansas Department for Aging and Disability Services. In a lot of ways, our system really mimics the community hospital system. And so that is something that we see an awful lot of in terms of county funding, state funding, private funding that might be from anywhere from insurance companies to private pay. And how we got here with mental health reform. The Mental Health Reform Act of 1990 was designed to shift from hospitals and community and the state mental health hospital system to to working more directly with our community mental health centers. And I apologize. Michelle, could you take this slide and go on for a second? I have a call I have to take about a daughter.
Yes, no problem. Mental health reform was a significant systems transformation in the early 90s that was really designed to divert resources and care from institutional care in the state mental health hospitals to community-based care. And that really created the community mental health center system and designated those community mental health centers, all 26, as the local mental health authorities. That makes the mental health service, community mental health centers play an important role to this day as gatekeepers to inpatient services. No individuals can be admitted to state psychiatric hospitals without having been assessed by a community mental health center and having been found to be in need of that level of care. At the time of mental health reform in the early 90s, the estimates were that community mental health centers collectively provided services to about 80,000 individuals annually. As of 2020, state data shows that that number is up to serving over 145,000 Kansans across the state. Another important system change that happened between mental health reform and now is actually the closing of 2 state mental health hospitals remaining. We currently have 2 within the state, and the 26 community mental health centers that work together to provide the mental health system in Kansas. And if you're back, Kyle, you could. I don't have the ability to switch slides.
That's all right. And so, yeah, and I apologize for that. I was thinking that the tag team may occur at some point during the presentation, but that was a little earlier than I expected. So where we're heading as a state is something that is very exciting for us in a lot of ways. And with the passage of House Bill 2208 in this last legislative session, this gives us an opportunity to participate in certified community behavioral health clinics, which are specifically designed to address challenges relating to the suicide crisis our numbers in Kansas simply have been staggering. In fact, I was telling someone the other day that this was the first year in 2020 that we had actually seen not just a flattening of our numbers with suicides, but a reduction. And so if it hadn't been for the pandemic, we could see ourselves going in a really positive direction. And part of that had to do with the state legislature enacting not just public policy initiatives, but adding funding to our system as well. Certified community behavioral health clinics, or CCBHCs, will also help address overdose deaths, barriers to timely access to addiction and mental health treatment, delayed care, inadequate care for veterans, and overburdened jail and emergency departments. One of the things that we talk about commonly with the CMHC system is it's not so much where are we, it's where aren't we. We work regularly with law enforcement, the courts, community hospitals, schools, and really there's a growing recognition that timely access to high quality mental health services really helps in every part of the community. This model also focuses on whole person care, providing access to mental health services, but also to integrated care that emphasizes recovery, wellness, trauma-informed care, and physical and behavioral health integration regularly. Equally as important, the model provides a sustainable approach for providing the necessary resources to providers. So what this essentially does is allow any mental health center that is working and provides Medicaid funded services to be paid at their cost. So cost-based reimbursement for a system that we hadn't seen, and Dr. Bjork probably knows this off the top of her head, but I think it'd been 10 to 15 years since there had been any meaningful rate increases, and there's nothing that operates like that anymore. So that has been something that we were really working toward with the CCBHCs. In terms of workforce development, again, providing an expanded service array, and they have to meet established criteria and quality measures and are supported by a sustainable payment model designed to accurately cover the cost of providing services, which allows them to provide competitive wages, recruit and retain staff, expand the service array and employ additional professionals, and be an employer of choice. So this really is to say we've competed a lot over the years, especially with schools, Veterans Administration, community hospitals, insurance companies, and more recently with the neighboring states of Oklahoma and Missouri. They are able to pay salaries in the neighborhood of $25,000 to $30,000 more than what we do, especially along the Oklahoma-Kansas border. And then Missouri, certainly with their medical staff. And if you hear us referring to medical and clinical, medical would be obviously doctors, nurses, nurse practitioners, and physician's assistants. And the clinical would be therapists and case managers along that side. So this has ended up being really a competitive in the Midwest. Also, you have Medicaid expansion. I suspect at some point someone would maybe ask a question about that. The way that I compare CCBHCs and that initiative to Medicaid expansion is exactly what it says in terms of being just expanding funding for a population. So by income level, expanding the number of people who are eligible to participate in the Medicaid program. CCBHCs is certified community behavioral health clinics are really depth. They provide, again, cost-based reimbursement. So you get paid more for the population you serve, and you're also required to provide additional services in exchange for that higher reimbursement. So whereas Medicaid expansion might be breadth and expanding population, CCBHCs are really the depth that you can get paid more for the folks you serve as long as you provide those additional services. As it relates to workforce development, as you see on this slide, it really gets into more of the nuts and bolts and statistics for what the benefit of being a CCBHC is, with 99% of the clinics reporting them having a full-time medical director compared to 82% prior to becoming a CCBHC. 91% reported employing adult psychiatrists compared to 70% prior to certification, 76% employing child psychiatrists as compared to 58% prior to certification. Just for context, and other states that are participating in this initiative, in addition to Missouri and Oklahoma, include Minnesota, Michigan, New Jersey, and Texas has a similar type program that they're running that is what we want to replicate. And then Oregon is another one. But child psychiatrists particularly are very rare. In fact, several years ago, I was presenting to a group in Western Kansas or Central Kansas maybe, and I mentioned that there were only 2 certified or licensed child and adolescent psychiatrists west of I-135. And there were a couple mental health center directors that came up to me afterwards and said, we want to know if you know what counties those 2 are in, because we're pretty sure you rounded up. And so the message being that they are just very hard to recruit and retain into the rural parts of the state. And we hope by being able to pay competitively that we will be able to recruit more medical and clinical personnel into rural parts of the state, really all parts. But if we can get folks to settle in, the rural part of the state, at least initially, hopefully they will fall in love with the way of life and not leave. And if they do leave, maybe they leave for Wichita or Kansas City instead of starting out in Wichita and Kansas City and then moving quickly to Denver or Dallas or someplace where they can make more money. State officials reported that the enhanced payment rates played an important role in CCBHCs building their provider workforce by allowing them to offer higher salaries and to hire different types and greater numbers of staff than they previously had the capacity to employ. So again, it just really is about jobs and recruiting and retaining the professionals that we need to not just be competitive with surrounding states. Kansas has a very rich history of providing mental health treatment services. In fact, the first ever director of the National Institute for Mental Health, Dr. Robert Felix, was from Downs, Kansas. And then you have the Menninger Clinic. And there was a time when just outside of Topeka, there was a sign that you would see on the highway that said, "Welcome to Topeka, Kansas, mental health capital of the world." So I think that when we lost the Menninger Clinic, to Texas, that was a real body shot to us as a state, because they used to produce so many clinicians, so many medical staff around the state. And so we're now to a point, because we're now about 20 years removed, not quite, from them leaving. And so a lot of those people who decided to stay here and raise their families and not relocate with Menninger to Baylor in Med Center in Houston, they're getting closer to retirement age. So if we did not have the CCBHC initiative in the wings ready to help us compete, we would be in a really bad place, because the number of psychiatrists who will retire in the next 10 years is greater than they're the majority of psychiatrists in practice. So I think that if we start looking at, the economic impact, again, survey of 128 CCBHCs around the country showed that over 5,200 new staff were hired, which is an average of 41 new positions per clinic. Just to give you an idea again of what that is in Kansas, the federal government through U.S. Department of Health and Human Services has been providing grants to participate in this. I think we had 9 apply last year, and only 1 received the grant, and they are out of Southeast Kansas. And then the feds decided that they had more money to work with, so they provided grants to another 5 of the mental health centers. So now 6 of our 26 mental health centers are working to become certified community behavioral health clinics. So that grant funding is a big deal. But then the second part of that is being supported through a prospective payment system. So if you all have federally qualified health centers, or federally qualified health clinics in your areas, this will be a very similar payment process to them in terms of again, that cost-based reimbursement. And so what House Bill 2208 helped us accomplish was putting in place a certification process through the Kansas Department for Aging and Disability Services to so that they can become certified, and then a payment process through the Kansas Department for Health and Environment, where that prospective payment system will allow the clinics to be more closely reimbursed with their costs. Health care and quality of life. Quality of life is a driving factor in the economic development of a community and is an important domain of quality of life. Or health is an important domain of quality of life, and well-being is a measure of population health that integrates mental and physical health outcomes. So this is something that you hear an awful lot about from policymakers around the state, talking about, having communities where people can live, work, and raise a family. So quality of life is certainly something that's associated closely with our state. Public support for mental health services. We've actually put out public policy polls the last couple of years. And I had no idea when we decided to do this where I really felt like, based on the conversations that I would either have with people around the state when I would travel, or with our mental health center directors, feeling like there was an awful lot of support for the work that they did, but just the funding wasn't there. And back in 2016, during the legislative session, our system was just decimated. We saw about a 10% cut in our overall funding from the state, which ended up being in the $30 million range. And so as we started to look at how to address that, we very quickly went on the offensive in terms of saying that, these are Kansas values, getting people connected with treatment and care that they need in order to be members of their family unit or members of their communities. And so when we put out the public opinion polls in 2019, those showed that a majority of the respondents in 2020, 48% in 2019, and 57% in 2020 indicated knowing someone who suffers from a mental illness or mental health issues. And then respectively, 41% and 38% of respondents indicated knowing someone who suffered from alcohol or drug issues. And of those, a majority of respondents in both years indicated knowing someone who sought treatment for mental illness, mental health issues, or alcohol or drug addiction. So one of the interesting findings, which was way higher than I ever would have imagined, was that when people were asked about public support and funding for mental health services, 76%, and it ended up being an identical number in 2020. So 76% of respondents indicated that Kansas should continue to increase investments in mental health services. And the significance of that has a couple pieces. One was we also, by category or crosstabs, as they're referred to, Democrats and Republicans almost equally, people who identified themselves as Democrats or Republicans almost equally supported mental health treatment and access to care and funding for mental health. Also, we polled ideologically. So we saw almost 60% of, or over 60% of those who identified themselves as conservatives expressed support for mental health funding and treatment. And then it was, I believe, low to mid 70% of liberals expressed support for behavioral health funding and treatment, and almost 80% of those who considered themselves moderates. So that was the highest category in terms of the expression of support for funding and treatment of behavioral health. The scope of the services provided, including the services and programs, outpatient services, so medication evaluation and management, family support and treatment, individual, group, and family therapy, community-based services like youth rehabilitation services, early childhood programs, including therapeutic preschool, early childhood intervention programs, autism treatment programs. This is something that really we've seen a significant growth in nationally in terms of school-based treatment. And Kansas, about 3 years ago, really went down that road, and just about every mental health center in the state now has some connection with local schools. And that's not to say they are in every school or every school building, but just about all of the mental health centers have some sort of either formal or informal relationship with schools to connect kids to services and treatment, because the number of kids suffering from anxiety or depression with the pandemic and all that's been, the uncertainty over the last year and a half has really, I think, thrown the need for services to a higher level, but also we haven't had as much opportunity to see the kids. So I think there are several of our folks who believe there's going to be a whiplash effect, and there will be an even greater need for kids to receive services and have access to services in the next year or coming years. Community support services, including adult rehabilitation services like case management, crisis intervention, psychosocial rehabilitation, and then substance use disorder treatment, emergency services, including 24-hour crisis services and crisis stabilization services. These other items are also examples of the work that CMHCs do around the state in their respective communities. We see more telemedicine use, obviously, than we've ever seen before, and the private health insurance, commercial health insurance companies are reimbursing for that, and actually reimbursing at the same rate currently, I think through the end of the calendar year at least, for those providing telemedicine and treatment, access to treatment in that regard. Prevention programs is also a significant part of mental health reform, which I sped through that early on. I know Michelle touched on it. Governor Hayden's mental health task force in 1989 really was the shot in the arm to get the Mental Health Reform Act of 1990 passed, and prevention was a significant part of that conversation. So community education and outreach, such as mental health first aid, suicide prevention programs, critical incident stress management, the Stepping Up initiative, again, connecting with law enforcement, depression and anxiety screenings, and parenting classes are all efforts that we use at prevention, and connecting people with services and treatment at the earliest possible point where they are suffering from mental health issues or experiencing mental health issues. Another example of prevention, and so what you will often see with community mental health centers is that they undertake activities or programs that are consistent with the values or interests of their community. So Johnson County Mental Health Center launched an effort called Zero Reasons Why several years ago, which is a team-led suicide prevention and education campaign. And I don't think there's any doubt among the kids, they're almost involved in every school district, I believe, in Johnson County at this point. And those youth have incredible passion for this project. And I don't think there's any doubt that among them or Leslie's peer at Johnson County Mental Health Center, Tim DeWeese, that they've absolutely saved lives through that program. Partnerships with businesses, so provider of employee assistance program benefits, trainings, and education like mental health first aid. That's something that I think that we really try to tout. Just about every mental health center around the state has trainers or the ability to provide mental health first aid. Certainly the workforce shortage during the pandemic has probably thinned those resources some, and that creates some challenges, but between mental health first aid or other health promotion activities and partnerships, certainly we hope that people will contact their community mental health center if they have the need for connecting or wanting their employees or members of the community to get more information on mental health services and treatment that's available, or mental health first aid. Again, it's an 8-hour class that really does, it's exactly what it sounds like in terms of explaining ways to identify people suffering from mental health issues and connecting them with treatment. So very much like regular physical first aid. That is our presentation, and certainly we would be happy to look back at some of the other slides that we've had, or open it up to questions that you may have about our system as a whole or public policy. or any other items of interest you might have.
Thank you, Kyle. The chat box is open if people want to enter in any questions that they want us to share or unmute themselves at this point. But Kyle, I think maybe I'll ask you to hit on a couple of things. Over the past several years, I've been able to work with Dr. Bjork on a variety of things, but probably this past year, I've probably tied up her phone a little bit more with my own mental health first aid questions. So have appreciated them as a resource for our businesses. But as we as economic development professionals last year, kind of like the schools, you know, we didn't have much face-to-face interaction with some of our businesses, and probably that's starting to pick back up again. Many of our businesses probably are not in a position where they're being able to have that employee assistance program in place. And so they're really going to be reaching out to you for those kinds of services. So could you maybe talk a little bit about that process, that intake, some tips for us as we're going out and maybe seeing some of those businesses for the first time, how to broach that conversation with them when we can see that they're stressed out and could maybe use somebody other than their spouse to holler at for a while?
Well, and it's a great question, Janet, and hopefully I'm thrilled to see Dr. Bjork take her mic off mute, because I was going to defer to her very quickly on this. But I think that one of the things you can use is our association's website as a reference to what community mental health centers are available to people around the state in their communities. But in terms of the specific approach, Dr. Bjork, would you speak to that for a minute?
I'd be happy to, Kyle. Thanks. And before I do that, I might just ask that you stop sharing your screen, and that way we can see everyone's faces a little bit better in the conversation. Janet, I'm really happy that you brought this up because I think through conversations you and I have had, we know that mental health is economic health. You know, one of the key symptoms of a mental health challenge is a reduction in people's ability to function, and that includes work functioning, right? And so I think this is a common problem. And so as far as the access, I would absolutely agree with what Kyle mentioned. The Association of Mental Health Centers website is a great resource that lists all 26 of the mental health centers that Kyle was referencing earlier, and has contact numbers available there on the website. Most community mental health centers also have some kind of a toll-free 24-hour crisis access number in addition to their business line, in which folks can call to kind of get some conversation and services started if that's the desire. And then I'll offer one more option and then maybe talk very briefly about what that entry into services looks like. It is possible to also contact 911 at the point of crisis. And all of our community mental health centers, as Kyle mentioned, are very linked into community law enforcement staffs and agencies. And we work in close partnership with those agencies to be able to route mental health concerns to the mental health center so that we can address those challenges and other concerns differently. There's a cool movement, Kyle could probably talk better than I about a move to a new statewide number so that we don't burden the law enforcement 911 number in the future, but that's not out yet. It's kind of in the works. When someone contacts a mental health center for service questions, what typically might happen, and I can absolutely speak to Elizabeth Layton Center, you're usually going to get possibly an administrative person on the line first that's going to help route your question in the best way. If the issue is one of an emergent crisis situation, such as someone's having some thoughts about hurting themselves or hurting someone else, that probably will get very quickly transferred to a licensed clinician to be able to address that and talk through the situation and de-escalate what's possible. If the situation is not of a crisis nature, if it's not at that level, then usually we're talking about what we call routine services. And so that usually means what would be called an intake session first. And that intake session, much like when you have a first appointment or an annual physical, there's a lot of information gathering. So the clinician will kind of go over some different areas that are important to mental health. and get some information. And by the end of that first session, the licensed clinician is able to give a great recommendation about A, whether or not there appears to be a mental illness here, and B, what's the treatment recommendations around that? And whether that's treatment through a community mental health center or treatment through another partnering agency, CMHCs, community mental health centers, are great resource hubs. As Kyle started out and Michelle mentioned, we're kind of authorities on mental health in our communities. And so we can either provide those services or link folks with those services. I would also like to promote that a really cool thing about community mental health centers is part of our licensing requirements provide for delivery of services regardless of the ability to pay. And I think that's really critical to understand, particularly in these challenging times when many folks are out of work and facing unemployment scenarios and a lot of economic burden. And so mental health centers work with individuals to understand what resources do they have and how can we fit in and provide services regardless of that ability to pay. So I know that Elizabeth Layton Center, for example, we operate on about a $5.5 million budget. And each year we write off about $1.2 million in service delivery. And so it's a huge part of what we do. And that's because we are dedicated to serving the needs of the community. We want to make sure that those services are reaching the folks where it needs to happen. And when we think about people who need services, I caution us to realize that it's 1 out of 4 of all of us. This isn't an issue that pertains to that person or that other individual. This is 1 out of 4 of the American public that are impacted and diagnosed with a mental illness in any given year. And so this is more prevalent than diabetes. It's more prevalent than heart disease. It's a really important issue, and it does impact our economy. I was just pulling up a quick stat that in 2010, the estimate was $210.5 billion lost to the economy just related to productivity challenges around the issue of depression. That's just one mental health diagnosis and a staggering amount of impact to our economy. So I think you all are in just a fantastic point within our communities to be able to understand the business needs and to know that 1 out of 4 of us means 1 out of 4 folks employed at a business that you probably have a relationship with. And I know Janet does a great job of coming to our center and other agencies within the county on a very regular basis to check in and ask, what are you experiencing? What challenges are you having? My guess is if you're having those conversations, you're probably hearing about mental health challenges across the businesses for which you have great partnerships. And in everything I'm reading and understanding right now about the workforce challenges, our workforce today really wants mental health support. It's one of the key factors I'm hearing coming out. In addition to equity, inclusion, and diversity, mental health support of our workforce is a key issue at this time to recruit and retain workforce members. And so again, I appreciate that Janet reached out and asked for this presentation today. I think you all are in a really key spot to be able to make a difference. And I hope that Kyle has helped you to see the value of the community mental health center system here in Kansas and the huge array of services that we're able to offer to try to prevent and help and address those challenges in a way that can get folks back up and functioning in our communities.
If I might just add a couple short points to Dr. Bjork's comments, I'm really glad that you brought up the requirement that mental health centers are required to serve anyone regardless of ability to pay. Sometimes we think of that as being individuals that are unemployed, but we do know that in the state of Kansas, there are a large number of working individuals who, because we have not expanded Medicaid, and some estimates are as much as 165,000 Kansans are working but uninsured. So those individuals that might be the employees of the businesses that you work with would be able to seek treatment either on a sliding fee scale or under those state-funded services for uninsured individuals through mental health centers. Kyle also touched earlier a little bit about telehealth. That is something that we've been using for many, many years, but has really ramped up under the COVID-19 pandemic. Some of the things that we're hearing from patients across the state that are seeking services through mental health centers are that some of them, whether they are anxious about returning to face-to-face environments, or whether just the convenience, the ability to continue receiving services via telehealth is something that I think will continue to be part of the service array moving forward. And for individuals that are working during the day and not able to take time away from that regular 8 to 5, that might mean that they can have that appointment over a break, over a lunch period, versus necessarily having to take a half a day of paid time off or vacation time in order just to be able to make an appointment. So that's another, I think, key point when you're talking with businesses that are trying to connect their employees with services, especially now. We are seeing data at the national level that the rates of depression and anxiety are quadruple what they were in 2019. So it's not even always just about, we tend to think about the crisis services because those are vitally important. But I think the array of services that mental health centers offer is really important to keep in mind too, because it may be somebody new who is just having a hard time dealing with the social isolation as we're coming out of the pandemic, or children that are struggling to manage school remotely. So people that maybe have not been connected to the mental health system previously, but could use a little bit of assistance, a little bit of help, and the CMHCs are available to do that as well.
Thank you. I think those are all great points. And one of the things that we've talked about with Dr. Bjork is the fact that we are a small community, right? And even though it's 1 in 4 of us that are suffering, there's still a stigma that's attached to it. And so the ability of her and her staff via telehealth or other methods to be able to maintain that client confidentiality, even in small towns, is very important, particularly when sometimes it's your business owners, your bankers, your community leaders who may be suffering the weight of the stress in particular that we've had this past year, who may be looking for some support. So thank you for that. And Steve, I haven't gotten any messages privately sent to me other than that. So.
Well, I have one. So let me add to the discussion. Kyle, you represent the Association of Community Mental Health Centers. That's correct. And Leslie, you run one. Is that right? In Miami, Franklin County. I'm interested in organization and governance and differences from county to county, because it sounds like a whole bunch of services provided by a one-stop shop in your county or your collection of counties. But here in Leavenworth, I know that the Veterans Hospital provides some psychiatric mental health services. I'm assuming the Fort Leavenworth does for its population. Our hospital, one of the one remaining after Cushing left, St. John, I believe has some psychiatric beds for seniors, but it was my understanding that there were no services for the 18 to 65 population until recently, when our county government, Board of County Commissioners, took over the old Cushing Hospital and signed a contract with Centerpoint, who will be coming to Leavenworth. It seems like, and this isn't, I don't mean this to be too pejorative, but a hodgepodge just in my county, and maybe only slightly confusing to the end user, the business, or perhaps an economic development director whose elected officials are pounding on him to know which population you fit into, to what number to call. So have I gotten this right, or am I confused? Yeah.
Yeah, no, I understand what you're saying. I might lead off at the macro level and then transition to Dr. Bjork so she can kind of talk a little bit about what that means also for her locally and working with, the Miami County Hospital and Osawatomie State Hospital, which she basically is in the shadows of in her communities. But I think that around the state, we've also seen, Steve, a reduction in the number of inpatient beds across the state. So at the same time, the state was taking on this value of reducing the number of state mental health hospital beds and thinking, okay, the slack will be picked up by community hospitals. They started closing beds too. And then even along the border, so Bartlesville Hospital across the border in Oklahoma closed some beds. And, on the Missouri side, Two Rivers closed from Kansas City, Missouri side. So we saw just a substantial, a lack of collaboration or a lack of connection that resulted in people saying, oh, they'll take care of it. They'll take care of it. And we really could have been in a situation a few years ago, 2016, I believe, or 2015. We've had a moratorium, a waiting list at the State Mental Health Hospital in Osawatomie for over 5 years. And again, people thinking, oh, well, the local hospitals will get it. And psychiatry it was hard to recruit specialists for, and it didn't reimburse the same way that oncology and cardiology did. So I think that connecting with the mental health center first has been and continues to be the right phone number to call. But the resources that the mental health center even had to refer people to was significantly reduced. And so my nightmare in 2016, 2015 was that there would be a whole bunch of finger pointing. And what we ended up seeing really was the ability of Kansas communities to come together and say, okay, state's not helping us out very much right now. So what can we do to help each other? Or, there were things like community crisis centers, co-responder units where law enforcement and mental health centers would show up together. Things like that, and school-based programs as well, that I think were partly spawned out of the lack of resources that were available to the state and some of these community hospitals that got rid of their and I've been to that Cushing Hospital. It'll be interesting to see what Centerpoint does with that, because it's still in really good shape from what I could tell the last time I visited. But Dr. Bjork, do you want to kind of give some background in your area and maybe some of your neighbors as well?
Sure, Kyle. Steve, I appreciate the question because I do think it can be really confusing to know where to go. And a lot of times different professionals have a lot of alphabet after the name, and it's hard to understand what that means as well. The way I look at it, kind of like Kyle said, I see the community mental health centers as a great first point of contact. We are the designated county entity authority for mental health services. And because of the licensing requirements that we have to be that entity, there's some special rules and requirements for us. For example, one of them is every year we must provide to the state a listing of all of the psychiatric resources within our local communities. And so we're responsible for knowing those resources and listing those resources for the state, knowing how to refer to each of those other resources and coordinating with those other parties as needed. And so I do think that consumer choice is important. And so there are options in some communities for consumers to choose from. And when you mentioned, for example, the VA medical system, that's dear to my heart. That was the first system in which I was employed, and I loved working with the VA. So that system is pretty exclusive to veterans and their family members, right? And so if I were a veteran or a family member of a veteran, that may be the first call I would make, because that's a system that's specially designed for me. Now, if I called the CMHC first and said, hey, I'm a veteran, I'm looking for services, what I would be telling that person is, great, we have a variety of services we can offer you. Here's what they are. And there's also a Veterans Administration facility in our local area, and here's how you can contact them, or can I make that call for you? And so I see the CMHC as kind of being that overarching authority of resources, so to speak, with other entities, perhaps sometimes a little bit more specialized in terms of the care that they offer. I would also suggest that, I don't know every system or all of the requirements of the different systems, but it seems to me that community mental health centers are one of the few that is required to provide 24/7 emergency mental health care, regardless of the ability to pay. And so I think that's a unique designation that we have that makes us a great choice for that first call for many people. But you described a couple of systems that are pretty different than ours. I think subpopulation specialty systems, inpatient centers, which is not typically something a community mental health center provides, but we do link people with those other systems of care.
Okay, that's very helpful. Anything else for the good of the order? We're just a few minutes before our hour is up. Anything from folks that haven't had any questions answered? Well, again, this has been recorded. Mary Perez will make make it available to folks, and we really appreciate Kyle and Leslie and Michelle, and obviously your idea to have this in the first place, Janet. Appreciate your time. So very valuable information. And of course, we can contact you if we need to, if we think of something that we've forgotten to ask now.
Absolutely. And thanks so much again for having us. It was nice to be with you.
Okay. All right. Thanks for the discussion. Presentation was great. We hope everyone found it valuable, and we wish everyone a great rest of the day. Thank you.
Thank you.